We started the Center for Health Policy in 2002, and Dr. Haglund and I were co-directors at that time.
Both Dr. Edison and I had a passion to try and improve healthcare in this state.
Karen and Chris were very excited about wanting to start the center and to have a collaboration between the government relations group and the Center for Health Policy that they were starting.
Missouri is not very healthy in general. Most people aren't very healthy, and it's getting worse. Our health indicators are moving down instead of moving up.
We also know that the state has significant public health problems, so high levels of disability, high levels of smoking, and high levels of obesity that we should all be facing right now, trying to do whatever we can to improve those problems.
We just knew we wanted to create a center that would serve the citizen of Missouri, particularly our most vulnerable citizens. And so we spend a lot of time communicating to others about these health issues and health policy issues. So we knew that right at the beginning, but we really didn't know how to get started.
We started quite small. We didn't have hardly any funding at the beginning. We did this just surely out of our own interest and passion and our own energy. The center has, especially initially, had a lot of support in terms of people willing to contribute from all the different colleges and schools on the MU campus, and including the hospital and clinics. So when you have that level of enthusiasm, it's easy to get things going.
And so from that, then we slowly grew, and as we branched out and took on new health policy issues such as health equity, health disparities, or health literacy, or we started looking at Medicaid data, we would just get new grants and contracts to build those services up and to support that work.
One of the benefits that we had was that we're really focused on policy, not the political component.
So we have worked very hard to maintain our nonpartisan credibility and our respect in the community. And so I think, we're in a place where people rely on us to provide good information, to provide connections, to provide leadership around certain issues.
I think that the center has added to the discussion about a lot of legislation in an unbiased way, looking at all the issues, keeping away from politics per se, but getting into the policy implications of a lot of the issues that we deal with.
It's important to bring everyone into the conversation. It can't be in one place. It can't be with one group of people. It has to involve everyone who is affected and everyone who contributes to delivering health care in one form or another.
The Health Policy Forum is important because we get to hear what our other members have been doing, their upcoming projects, their submissions, their things that they've gotten funded for, and in that case it is a collaboration building.
And it brings up issues that people can follow from month to month or quarter to quarter. There is no other opportunity for them to convene in that way. So the center becomes the convener, and that is a wonderful role for the center to play.
We spend a lot of time building bridges between academic researchers and policymakers and lawmakers. So our health equity work is making a difference. We're learning about what we can do to make things better for those groups and their access to health care and health systems. We do a lot of work around health literacy, and we have a standardized training program for doctors and hopefully soon to be other healthcare providers about how do you change how you communicate with your patients and make it more understandable for those patients.
Different people might have different ideas about what the best outcomes were from the work of the center, but in my mind, the Center for Health Policy has been a tremendously positive force in the state in the area of health literacy. So
we have many programs and projects, and While they sound like they're not related, they really are all interrelated. Putting people together, making the connections, linking people and programs that have needs with those resources that are available has been one of the functions of the center.
The center has brought to the forefront and then to gather momentum, if you will, in order for folks to see the importance and then to see how they can work together in order to make a difference.
The summit is important because of the one aspect is the collaboration.
I think it's one of the times in the year when we bring leaders in all those organizations from around the state, the various stakeholders that I spoke about, together. It has become a valued meeting that people look forward to every year.
The number of speakers we've had has been quite diverse. The more diverse you can have it, the more you can appeal to a broad range of people.
I'm also very excited about the Healthy Community Initiative. That's a project we're doing in collaboration with Family and Community Medicine. And that's a project where we are trying to figure out how, as a university, we can partner with communities in a humble and service-oriented way to improve the health in those communities.
We started more recently to focus on kind of community-based research and policy, and so I would love to see that continue to grow, because that's really different. It's really, working very closely with communities from the beginning, so that you're formulating research questions with the community that really matter to the community and not just matter to scientists in a lab.
So my hope for the center in the future is that it is thriving and working hard long after I'm gone.
She has a great vision for the health and the future of Missouri. She's an incredible motivator. She's got a lot of positive energy and really knows how to galvanize folks around an issue and engage and energize them to want to form a solution and work on issues like that.
First off, I think it's incredibly important that we have a female leader of the Center for Health Policy. She's a very open-minded individual. She really is aware of what's going on at the national level as well as the state level, and has really dedicated herself to promoting the center ever since it started.
Well, I hope it continues to thrive as it's been thriving over the past several years, and grow and continue the recognition that it deserves.
So I'd love to see, a expanded role for us, especially as the ACA rolls out, and there are going to be organizations who are going to serve as navigators to help folks sign up for health insurance and make those decisions about which insurance options fit them the best.
Well, I would like to see us continue educating about health reform. I think this is going to be, I know this is going to be a big issue for a number of years. I remember when we first moved to this building, this conference room seemed huge whenever we would meet, and now we're just packed.